Hi, Victoria, how are you?
Hi, Dr. Mona. I am absolutely brilliant, thanks to you.
Yeah, thank you very much. So, Victoria, you came to my clinic how many months ago?
I came here, the first time I came here was in May. I had woken up, I couldn't move, I couldn't get out of bed.
Yeah.
I came to the AFIDA clinic,
Yeah.
I had an MRI,
Yeah.
and I was referred to you. And I had 2 protruding discs in this side of my neck.
Yeah.
I had some osteoarthritis here,
Yeah.
and because of the issues with my neck, I had complete muscle spasm and cramps in my back,
Yeah.
and it was very severe.
Yeah.
I couldn't move at all.
Yeah.
So after attending your clinic, you had devised a course of treatment of the steroid, the nerve block injections,
Yes.
followed by PRP.
Yeah.
I would have to say, for me, after the very first nerve block injection into the joint, I immediately noticed a difference in the pain.
Yeah.
Because what was happening was I had pain and it would settle and I'd feel like I could do things,
Yeah.
and then the next day
Yeah.
I'd be back in pain again. But after I got the injection, after about the first week, I could definitely feel an improvement.
Yeah.
We're 6 months down the line now. I've had my nerve block injections and then started the PRP.
Yeah.
I had to take a month off work because I couldn't sit for any length of time. I couldn't walk, I couldn't stand,
Yeah.
I couldn't exercise.
Oh, yeah. Yeah.
And now I'm back in work full time. They don't recognize me because I'm so full of energy.
Yeah, you're just saying this.
Yeah, I'm so full of energy. I feel like myself again.
Oh.
I was feeling like I couldn't do anything, and I didn't realize how much the pain was affecting me.
Your life.
My life. Yeah, I got very down from it.
Yeah.
But once I could feel the treatment working,
Yeah.
it was like a light at the end of the tunnel. So
Yes,
I'm
yes.
so appreciative of all the treatment.
Thank
and
you. Thank you,
yeah,
Victoria.
thank
How many
you.
years you have this pain?
I have had some trouble with my neck for the last 10 years.
Oh, that's a long time.
A long time. And I was always very conscious and careful of it. But every time I tried to exercise, I'd end up with kind of muscle spasm or neck spasm.
Yeah.
And it just, I suppose, the last year has been very busy for everyone, and just a combination of, you know, a lot of things. And I just woke up and I couldn't move.
Yeah, and you came as an appointment here in AFIDA Express Care.
Yeah.
You had a lot of pain that time.
Yeah, I literally
so
couldn't
stressed.
move. I thought I was going to have surgery. You know, so having had the consultation and the option of not going down the route of surgery, I was just so relieved.
Yeah.
But it was a tough journey, but you know, I'm so delighted. I think if I have a few more injections, I'll be cartwheeling into the surgery.
Yeah, you had also problem with the muscle between shoulder blades.
Yes,
It was a lot, like the whole muscle really down.
Yes,
it was
yeah.
so sore,
It was very, very painful. The muscles were in complete spasm.
Yeah, I see that.
And I would have gotten like sports massages and massages throughout the years. And I do, in February I could feel my neck getting tight, and I had gone for a massage, and I remember the therapist at the time sweating by the end of the session, and she was like, oh God, it's so bad, you know, I don't know if you've come to me too late. And I thought, sure, it's just muscles. And then 3 months later I couldn't move, so I probably at that point should have come, but you know,
people think that they might improve with time. They do everything, and you were doing everything correctly, but pain wouldn't go away. We know that.
So I'm looking forward now to getting back to the gym, getting back to exercise.
And you started actually.
Started walking, and I could, you know, I love walking. I'm not a huge fan of running or gyms, but I love walking, and I could walk for miles, and that was one of the things I couldn't do. I really missed walking. So hail, rain or snow, I'll be out doing a couple of kilometers every day.
We have just a couple of sessions PRP treatment, and then you'll be flying. Hopefully.
Oh God, it's amazing the difference so far. I really and truly, it has made such a difference.
Did you feel any difference between the steroid and the PRP?
I suppose maybe it's a timeline, but definitely from the steroid I had definitely felt pain-free. But in the last 2 months since I started the PRP, my energy levels are just different.
High?
Yeah, much higher.
Yeah.
I even though I was kind of pain-free from the injections, the steroid injections, I was very tired.
Yeah.
And obviously if you're in a lot of pain, and even as that goes, that's probably part of it. But definitely the difference in energy since I started with the PRP. Like I'm up in the morning and I'm in, as I said, I'm in work, and you know, I'm back to being able to do 10 things at one time rather than, you know, sitting there trying to concentrate going, I don't have the energy.
Actually PRP is improving the immunity. It boosts the immunity, and pain itself, when you are free from pain, your energy level will go up. Definitely. Because pain can affect the whole nerves and the whole immunity level, including of course depression when people are down and frustrated because they cannot get any relief. But steroid can work anywhere between weeks to maybe 4 months, but now we are 6 months down the line and you're still pain-free.
Still pain-free.
And I would say this is the PRP, and by the end hopefully you will get more than 2 years.
Oh, that's fantastic.
And as I mentioned to you, there is a stem cells coming now, which I'm going to start very soon, and the stem cells is as much higher in the PRP. It's about 18 times higher, and the mesenchymal cells that we get from fat is really high to regenerate or repair the tissues.
Well, if you need a donor for the fat, absolutely.
All women will be very happy. We take it from the tummy. So thanks very much, Victoria.
Oh, thank you, Dr.
And it's okay to put this on the website and Google and Facebook.
Absolutely, and I'd recommend it to anyone who's in pain like that. It's been such a difference. You know, I've never had pain relief like this, and I feel like I could actually, you know, do whatever I want to do without worrying. And I haven't had any setbacks, any spasms or anything like that in my back, that I'd be prone to the back spasms, you know, throughout the years. I haven't had any since the muscles have relaxed. You know, so.
I suppose the problem with the steroids that they weaken the muscles, they damage the joints and the cartilages. Over time, people come every 3 months, every month, every 6 months, 4 months, whatever, and repeat. You are never out of this. And pain come always back. But with PRP and then the stem cells, we are looking out for really longer term treatments.
No, it's been fantastic.
Delaying surgery if needed and all these things. So thanks very much, Victoria.
No, thank you, Dr. Mona.
Thank you very much. So thank you very much, and we'll see you again. Bye bye.
Thank you.